Hi, my name is Michael Schifano. I'm an OBGYN physician at Heartland Women's Healthcare. I'm excited to tell you about a new treatment today for urinary incontinence. It's called Bulkamid. Bulkamid is a injectable product. It's actually a polyacrylamide gel, which is a neat concept because it doesn't get absorbed by your body, so it lasts for a long time. So stress urinary incontinence is a leakage of urine with a cough, sneeze, or exercise. It's extremely common in the United States. And one of the most frustrating parts for me as a provider is patients coming in and they won't even mention it because they don't think that there's anything that can be done about it. They're either embarrassed about it or they think that it's just a normal part of aging. The exciting part is that there is something that you can do about it, and it's relatively simple. So incontinence, there's usually two components to it. Most women have a little bit of each. One we call is urge incontinence, and people remember that from all the commercials that you gotta go right now. That's where your bladder spasms and you can't make it to the bathroom on time. And that's typically medically treated with a medication, and you take a pill and it helps relax the bladder. However, that's only a portion of incontinence. The other portion is just the weakening of the urethra. That's from childbirth, years, age, all the above. And that is typically treated surgically. In the past, options included a sling, which includes mesh, which is highly successful. However, it is surgery. And there's always the risk of erosion or pain from the mesh. There's also been bulking agents. They're not new. They've been around for years, where we inject, it used to be collagen next to the urethra, and it helped occlude the urethra enough to retain urine. The problem with collagen was it's absorbed by the body, and these treatments would have to be repeated quite often, almost too often for patient comfort. The new products, such as Bulkamid, are not absorbed by the body, and they last for many years. So a simple 15 to 20 minute cystoscopy, where the small scope is placed to the urethra, and then we look into the bladder, and we give directed injections around the urethra with this substance, you get immediate success and results where the urethra is now stronger because it's been bulked up with these agents, and people don't leak urine as much. Any patient who leaks urine would be a candidate for Bulkamid, and that can include a young woman in her 30s who just recently, had a baby maybe 6 months ago, and now has tried Kegels exercises and is just not able to control leakage of urine. Jumping on the trampoline is out of the question. I really tell people, you're a candidate if you have to wear a pad or even a liner because you're concerned about leakage of urine. If you so much as even have to wear a small liner, you should consider a Bulkamid treatment. If you ever resist going out with your friends because the thought of getting together and laughing, the possibility of leakage of urine during that instance scares you, that you're not going out as much, you definitely need to be considered for this treatment. So the results have been overwhelmingly positive, and we're seeing over 90% of women are either markedly improved, and when I say that, it means they maybe still leak once a month or a couple times a month, to just a complete cure where they never leak again. So it's really a remarkable process. And even in the small amount, that the less than 10% failures, they can still have another injection maybe 6 months down the road to actually improve the results. It's almost rare that we see someone that just had no effect whatsoever. This doesn't mean that they can't still do a sling down the road. Like if they choose the Bulkamid injections and they just don't get the results they want, a sling is still an option down the road. There's really no place in today's world for incontinence. With all we can do to help, I would encourage you, if you even leak urine a little bit, to come to our office and let us evaluate you for a Bulkamid injection. Bulkamid is widely accepted, and it's a very simple workup. The procedure itself literally takes maybe 15 to 20 minutes, and people go home the same day and have very little restrictions. They can go back to work later that day or the next day. So I'd invite you to come on into the office and let us help you stop leaking.